Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, June 24th. It's a few minutes after 5. Sorry, I'm late. Okay, so let's talk about one country who's doing things differently than almost everyone else, and that's Sweden. Okay, they have not locked down their people or economy and are aiming for herd immunity. We've talked about herd immunity before. For months, the Swedish health authorities have defended this very controversial decision during this global pandemic. Schools are closed to children over 16 and gatherings of more than 50 people were discouraged, but bars, restaurants, and other public spaces remained open, and citizens were simply trusted to distance themselves. Now, their goal was, as I said, herd immunity, which occurs when anywhere between 50 to 90% of the population becomes immune naturally to a disease, a virus, therefore stopping the spread of the virus. Now, at first it seemed to be working, and I'm not saying that it's not, but at the end of April, epidemiologists said the rise in infections was beginning to flatten and had plateaued in Stockholm, which was considered the center of the Swedish outbreak at the time. Now, as of June 12th, Sweden has the largest number of cases and fatalities in Scandinavia, with 3 to 5 times the number of cases as neighboring countries. Now, there's a but to that. Now, between May 25th and June 2nd, Sweden had the most coronavirus deaths per capita in Europe. Now, what about herd immunity? Now, an ongoing nationwide study conducted by the Swedish Public Health Agency found only 7.3% of Stockholm residents had antibodies to COVID-19 as of the end of April. Okay, now that's not the end of May and that's not the middle of June. So we're talking about 6 or 7 weeks ago. Okay, so those numbers could be way higher by now. Now, the biggest problem with looking at antibodies to determine herd immunity is that recent studies are actually suggesting antibodies are only detectable for a period of time. Months after infection, they may not be detectable. But that doesn't mean that if you're re-exposed to the virus when your antibody levels are undetectable, that your immune system can't respond as it should and produce antibodies to prevent infection. Now, we simply don't know yet. But if this virus acts like any other virus, then you should mount an antibody response when you are re-exposed to the virus, and we should maintain a normal immune response. Again, this is a coronavirus. This is a respiratory virus. There are many viruses that we never become immune to. Herpes, the ones that kind of come back. Chickenpox comes back. HIV never goes away. But a coronavirus is a respiratory virus. So we do develop immunity to other coronaviruses. We develop immunity to influenza and other things. So there's no reason to assume that we won't, but only time is going to tell. Now, not unlike anywhere else, the largest percentage of deaths in Sweden have been in care homes for the elderly people. This is being blamed on asymptomatic family members actually spreading the virus to the more vulnerable. So again, the situation isn't any different. They just didn't lock down. Now, the government insists that other countries are not reporting their actual death rates, and Sweden is the best in the world at this. So they're saying something similar to what's going on here in the United States is we're doing more testing and we're reporting true numbers, where lots of other countries, including China and many other countries, are not testing as much and are underreporting their numbers. So I'm not saying that Sweden is doing the right thing. Only time will tell if they do develop herd immunity. There is just too much uncertainty to point the finger and say they are doing it right or wrong. It's just they're doing it different. And I know here in the States, we talked about how we were trying to flatten the curve so that we wouldn't overwhelm the healthcare system. Now the curves are starting to increase again, but we're still within the healthcare system manageability. And that was the concern. Not that we want this virus going rampant and more people to get ill or die, but we are months into it now where they're starting to come up with treatment remedies and things that are helping and decreasing the chances of death. Again, nothing is absolute and nothing is perfect, but compared to where we were in March and April, we are in a better place now, even as the numbers do increase. Okay, again, the population that's getting hit more now, or a younger population who are likely to go through an infection much more, I guess, much better than the elderly. And so the numbers may increase, and maybe we will develop herd immunity because of that. I'm not saying go out. I'm not saying don't social distance. I'm not saying don't wear a mask. I'm not saying don't wash your hands and hand sanitize. I'm just saying at some point we hope to create herd immunity here in this country and everywhere else so that this virus does go away of sorts. It doesn't continue to spread like wildfire. So only time will tell if Sweden has done it correctly, or they're going to pay the price. So on that note, I hope you guys are having a wonderful day, and I will see you again tomorrow for another Live in 5.